everyone, and welcome back to Neuropsych. So in the last video we went over introduction to drugs in the brain, and in this video we are going to start going over the different classes. So classifying and grouping psychoactive drugs is very difficult because most drugs influence many behaviors. And further, drugs with similar chemical structures, they can have totally different effects. And drugs with different structures can have similar effects. So that makes it really hard of classifying these different psychoactive drugs. So we can roughly group the drugs in 5 groups based on their most pronounced behavioral and psychoactive effects. So each of the 5 groups may contain from few to many thousands of different chemicals in its subcategories. So most psychoactive drugs have at least 3 names. So they have a chemical name, a generic name, and a brand name. And some of them even have many street names. So definitely remember that: a chemical name, a generic name, and a brand name. The chemical name describes a drug's chemical structure, so the little chemical subparts it is made of. The generic name is non-proprietary, and the capitalized brand name is proprietary to the pharmaceutical company that sells it. Okay, so there are 5 classes of drugs based on their most pronounced effects. So we have the sedative hypnotics and anti-anxiety agents. Then we have the antipsychotics. We have the antidepressants and mood stabilizers, the opioids, and the psychotropics. So let's go over those. We are going to start with the first 2. So we're going to start with the sedative hypnotics and anti-anxiety agents, and then we're going to go over to the antipsychotics. Okay, so the first group contains the anti-anxiety agents and sedative hypnotics. So at low doses, these anti-anxiety drugs and sedative hypnotics, they reduce anxiety. And at medium doses, they will sedate you. And at high doses, they can either be used as an anesthetic, or if too much is used, they can induce coma. And at extremely high doses, they can kill. So obviously, the more you take, the more risky it is. And the difference between anti-anxiety drugs and the sedative hypnotics is that anti-anxiety drugs are safer at high doses compared to sedative hypnotics. So sedative hypnotics are way more dangerous than anti-anxiety drugs, although you should never take both in large quantities. Okay, so here you see the behavioral continuum of sedation. So as you can see, here you can see the increasing dose, and here you can see the effect of the drug. And increasing doses of these sedative, hypnotic, and anti-anxiety drugs will affect your behavior. So low doses will reduce anxiety, and very high doses will, in medium doses sedate, and then in larger doses, they can be used as anesthesia, and if too much is used, it can result in coma or death. The most commonly known anti-anxiety agents are the benzos or benzodiazepines, such as diazepam. So the benzodiazepines are marketed as Valium or Xanax or Klonopin. Benzodiazepines are often used by people who are having trouble with coping with major life stressors. So they're also given to help sleeping, and they're also used pre-surgery as like a relaxation agent. Sedative hypnotics include things like alcohol and barbiturates. Alcohol is well known because obviously it's widely consumed, and barbiturates are sometimes still prescribed as sleeping medication, but mainly they're used for anesthesia before surgery. So both alcohol and barbiturates induce sleep, anesthesia, and they can induce coma when they're taken at very high levels. Okay, so in between the slides, whenever I'm talking about the different drugs, I want to talk about some neurotransmitters. So let's start off with this one, with GABA. So GABA is a neurotransmitter, and it works by blocking certain impulses fired between nerve cells in the brain. So low levels of GABA, for example, are associated with chronic pain or epilepsy, anxiety, and other types of mood disorders. So there's a theory that one of the roles of GABA is to produce a relaxing effect on the nervous system. So if you have a lot of GABA in your brain, it will give you a more like relaxing effect. And a GABA receptor has two sides. It has a sedative hypnotic side and an anti-anxiety side. We're going to go over this in a little bit more detail in a later slide. Oh, and this is that slide. So GABA is an inhibitory neurotransmitter. So here you can see the GABA receptor, and it has a chloride channel. So whenever GABA is attached, it opens up and chloride can go in. So whenever this receptor is excited, or whenever excitation of the receptor happens, it will produce an influx of chloride ions through its pore into the cell. So an influx of chloride ions increases the concentration of negative charge inside of the cell. So again, it will hyperpolarize it, and it will make it less likely to propagate an action potential. So the inhibitory effect of GABA is to decrease the likelihood that this neuron will fire. So widespread reduction of neuronal firing in part underlies the behavioral effects of drugs that affect the GABA synapse. So the GABA receptor has binding sites for chemicals other than GABA, as you can see in these pictures, on the right here and right here, so on both these sides. So one of those chemicals are barbiturates, and as you can see that here on the left. So this could be either alcoholic chemical or a barbiturate. And another one of those chemicals are benzodiazepines. So you can see that here in the middle, so benzodiazepines. Alcohol and barbiturates act like GABA, and they cause the channel to open, so letting chloride into the cell. And benzos, they work a little bit different, but they have a similar effect. Benzos enhance the binding of gamma, so they kind of are helpers to GABA. So GABA will bind easier to the receptor, and it will also increase the influx of chloride into the cell. So because these have super similar effects, but because they have different sites on the receptor, these things can never be taken together. So you can never take alcohol with benzos or barbiturates with benzos, because then there would be a two-doubled increase of this chloride influx. So it's really bad. So always, if you're prescribed any of this, never take them together. Okay, so here's a little recap of what I just mentioned. So all sedative hypnotics work by influencing the GABA receptor. Alcohol barbiturates, they bind to the sedative hypnotic site and increase the influx of chloride, causing hyperpolarization. Barbiturates increase the binding of GABA. Benzodiazepines, they bind to the anti-anxiety site, and they maximize the time the pore is open and influence the frequency that the iron pore opens in response to GABA. So they kind of help GABA bind to the receptor. Okay, so as I just said, throughout the slides, I'm going to talk about some neurotransmitters. We just talked about GABA, so the last one was GABA. Now we are briefly going to talk about dopamine. So dopamine is a neurotransmitter that helps controls the brain reward and pleasure centers. So people with low dopamine activity may be more prone to addiction. And the presence of a certain kind of dopamine receptor or too much dopamine is also bad. So it's associated with sensation-seeking people, more commonly known as risk takers. Okay, so let's go over the second group, the antipsychotics. So the term psychosis is applied to behavioral disorders such as schizophrenia, which is characterized by hallucinations or false sensory perceptions and delusions, which are false beliefs, and also other symptoms. So the use of antipsychotic drugs has improved the functioning of schizophrenia patients. And about 1 in every 100 people have schizophrenia, so it's pretty common. However, antipsychotic drugs are not a cure. They can just help alleviate the symptoms. Okay, so technically there are 3 subgroups of the antipsychotics. Antipsychotics have been used since about 1950s, and the first group of antipsychotic drugs are now called first generation antipsychotics. And they include a class of drug called the phenothiazines. And there's another one called the butyrophenones. So you don't have to remember these names. But what you do have to remember is that these drugs, they act mainly by blocking the dopamine D2 receptors. Okay, so later on, it was about 1980s, and there were newer drugs being created. So these newer drugs that were created were called the second generation antipsychotics. So this included drugs such as clozapine. The second generation psychotics, they weakly block the D2 receptors, but they also block serotonin receptors. So remember that the second generation antipsychotic drugs, they weakly block D2 and they also block serotonin receptors. However, these antipsychotics had a lot of side effects, and one of the big ones was weight gain and motivational changes. So they're developing new drugs, and the drugs that are now being developed are the third generation antipsychotics. Okay, so the therapeutic actions of these antipsychotic agents is not fully understood. The dopamine hypothesis of schizophrenia holds that some forms of the disease may be related to too much dopamine activity or excessive dopamine activity. So other support for the dopamine hypothesis comes from the schizophrenia-like symptoms of chronic users of amphetamine, which is a stimulant. So here you see the picture. And here you see amphetamine and amphetamine. Here you see chlorpromazine. So amphetamine is a dopamine agonist. It promotes the release of dopamine from the presynaptic cell. And then it also blocks the reuptake from the synaptic cleft. So if amphetamine causes schizophrenia-like symptoms by increasing dopamine activity, the argument is that naturally occurring schizophrenia is related to excessive dopamine action too. Okay, so as we just talked about it, schizophrenic symptoms are related to too much dopamine, and chronic users of amphetamines can show schizophrenia-like symptoms. So other drug models of schizophrenia include the psychotropic stimulant LSD, which stands for lysergic acid diethylamide. So LSD produces hallucinations and are a serotonin agonist that act at the serotonin receptor, or we also call that the 5-HT receptor. So hallucinations are symptoms of schizophrenia, suggesting that an increased level of serotonin or excess serotonin action is involved in schizophrenia as well. Okay, so that was the end of this video, and I will see you guys back soon for the next video.